group. So we'll just start. So for those of you who don't know me, I'm Dr. Darvish. I'm the founder and medical director of Holistique Naturopathic Medical Center here in Bellevue. And I welcome all of you. This is a forum for us to present some new thoughts and ideas and research from a very holistic perspective. And we will have various doctors for the next few weeks doing presentation. This one is going to be presented by Dr. Murella. Wave your hand, doctor. So Dr. Murella has been with us for a couple of years. She's just finishing her second year residency. She is also a licensed acupuncturist and a licensed massage therapist. And there she is. And she specializes in integrative primary care, acupuncture, chronic disease, women's health, gastrointestinal disorders, physical medicine, sports medicine, IV therapy. And then we also have Dr. Paroo, Nina Paroo. Do you want to wave your hand, Doc?
Hi.
There she is. Oh, we missed her. There she is. Okay, so Dr. Paroo has been with us for about less than a year, but she has been practicing for almost 19 years. And she specializes in integrative primary care, chronic disease, detoxification, and drainage, lifestyle medicine, and a whole bunch of other stuff, including IV therapy. So we're so happy to have Dr. Paroo with us. Just before we get started, I just wanted to put out a disclaimer that we are not giving out any medical advice during this Zoom call, that please do seek a medical profession to evaluate you, that any discussions we have about any treatments or therapies, potential therapies or treatments, are not meant to be taken as a claim on a treatment, cure, or diagnosis for any condition. So just wanted to put that disclaimer out so that you don't take your own healthcare into your own hands, and you do seek a professional. So without further ado, I will turn it over to Dr. Paroo and Dr. Murella.
Thank you, Dr. D. So hello, everyone, again. I hope you're not tired of my face. But I just want to say thank you for allowing us to have this educational talk with you, allowing us to be vulnerable, because you know, it's not easy to talk to so many people, even if it's virtual. So I'm super thankful for you guys. So today we're going to talk about the gut-brain axis. So how the gut and your microbiome affect your mental health and your mood. So that's me, and you guys know a lot about me and Dr. Nina now. So the first thing we're going to do is just talk about a glossary of terms, and that's just because there's a lot of vocab that might be really new to a lot of people. And so the first one is the microbiome, which is something that I already mentioned that we were going to talk about, but it's the complete genetic content of all the microorganisms that typically inhabit a particular environment, especially a site on or in the body, such as the skin or GI tract. Today we're going to talk about your microbiome in the GI tract, and it is a collection of different bacteria, yeast, fungus that are all in your gut to help you stay healthy. And we'll talk more about the specific functions in the next few slides. The next one is the blood-brain barrier, and that protects the brain from damage from internal threats in the body. So it's a barrier that protects your brain so that there are no threats that can affect its function. And then dysbiosis is imbalance in your microbiome. So it can be an overgrowth of bacteria, it can be an undergrowth of bacteria, it can be parasites, it can also be an overgrowth of yeast or fungus, etc. And so we'll go into the next slide. Oops, let me click on this, that's why. Okay, so the human microbiome. So the function of the human microbiome is that it defends us from disease. It does help us digest food. It helps us metabolize the nutrients from our food. It helps maintain mucosal barrier, so in our intestines as well as the blood-brain barrier. And it also helps with preventing chronic diseases. And so in terms of bacteria, there's more than 500 to 1,000 different species of bacteria in the gut. And it's very unique to an individual. And everybody generally has the same, species and or 2 different phyla or categories of bacteria in their gut, but the amount of it is very unique to everyone. And so the human microbiome is first made when you are in utero in your mom. And so essentially whatever's going on in your mom's microbiome can also affect you. And then as you age, your microbiome will change based on, whether you're breastfed, what foods you're eating, what medications you're taking. And so in that next bullet, it says influenced by diet, age, genetics, environment, environmental toxins, birth circumstances, which I just mentioned, toxicants, hormones, medications, stress, and stimuli. And the thing that I want you guys to really remember is the maintenance of mucosal barrier. So when we see that the microbiome is unbalanced, we do see leaky gut and a leaky blood-brain barrier. And what that means is that the cells that make up the intestinal barrier and intestinal lining, as well as the blood-brain barrier, there is more space in between those cells. And so it allows for bigger molecules or proteins or pathogens to essentially slide right in between those cells and enter our bloodstream and cause systemic issues. And we'll go into it here. And so in this particular study, the researchers researched 2 different groups of mice. One group was a group of mice that had parasites, and the second group was mice that had normal bacteria. And what they saw was that the mice that had parasites had a leaky blood-brain barrier. And in fact, when they fixed their flora, when they got rid of the parasites, they noticed that the blood-brain barrier would then heal. And the way that they measured this was testing for expressions of certain proteins, which are indicated right here, so occludin and claudin 5. But what does that mean? So I did mention this, which is when, the barriers that we had just mentioned are leaky and or have more space in between their cells, then that means that their protection is not as strong and they are more susceptible to certain threats. And it would make sense that if your brain is being attacked by certain inflammatory markers or pathogens, that might affect your cognition, your mood, might cause anxiety and depression. And in fact, in this next slide, this is another study that they researched veterans who had PTSD and those who did not have PTSD. And they noticed that people who had PTSD had a lack of diversity in their microbiome. So what that means is that there was less species in their microbiome, which you want to essentially have more or different types of species in your gut so that you're able to digest certain things better. And they also found that there was more of a certain type of bacteria that is associated with decreased cognitive function. So again, here we are seeing that whatever is going on in your gut can affect your brain and thus can affect your mood. And in this case, it may be connected to PTSD in these veterans. So I think some of you, if you were hanging out with us last Wednesday, may have seen the first part of this figure. But again, I just want to take it back to our nervous system. So, and how being in chronic stress can affect our digestive system. So there are two different parts of our nervous system. And this is specifically our autonomic nervous system. There's so many different types of nervous systems in our body, but the first one is our parasympathetic. So this is our rest and digest. This is where we want our body to be when we are eating our food. But then when we're in a state of chronic stress, we're activating our sympathetic nervous system, so our fight or flight. And remember last week, I used the analogy of running from a bear. So when we are chronically stressed, we are constantly running from a bear. And when we're running from a bear, we want all of our circulation or our blood to move towards our extremities. So our hands, our feet, so that we can run fast. And so there's not going to be a lot of focus or circulation to our abdomen, where our intestines and our stomach is. And so there's going to be a decrease in digestive function. And because there's going to be a decrease in digestive function, you can imagine that there'll be a decrease in absorption of certain nutrients. And we'll go into talking about the amino acids. But this whole concept is the heart of mindful eating. So I'm sure Dr. Darvish has told you guys multiple times, maybe in your visits with her, the importance of chewing. So making sure that you're chewing, and also paying attention to the foods that you're putting in your mouth. And we're not focusing on the TV or our phone, and we're just being mindful of the food in front of us. So I'll go into the next slide. So what are our neurotransmitters? So all of our neurotransmitters are derived from amino acids, which come from protein that we digest. And so here are the common neurotransmitters, and we'll go into detail about every single one of those neurotransmitters and what their function is. But there's serotonin, dopamine, norepinephrine. Dr. Paroo always makes fun of the way I say that, so now I get very self-conscious of saying that word. Epinephrine, GABA, and glutamate. And I put just some information that you guys can read as to what amino acids specifically make up these neurotransmitters. So the first one, serotonin. So it functions in our mood control, sleep, pain, GI motility, and the levels of serotonin can affect our mood. So high or low serotonin levels are associated with depression, and low levels can cause appetite change. So if your levels are low, then maybe you're not going to be as hungry, or maybe you might not want to, eat. And then we do know that serotonin is synthesized in the gut. And so when there is a change in our microbiome, then we know that serotonin is likely not going to be synthesized as much. And then thus it can affect our mood, our sleep, our pain, our GI motility. Dopamine. So dopamine is our reward response. It stimulates our pleasure center. So this is what spikes every time we get a text message, every time we get a hug. And so it affects our sleep, our mood swings, depression, anxiety, lack of motivation. It can affect our libido, as well as our attention and learning. And norepinephrine and epinephrine. And so these ones are part of our sympathetic nervous system. So remember, our sympathetic nervous system is our nervous system that helps us run from a bear. And it helps with regulating our heart rate and blood pressure, and also regulating glucose, so that we have enough glucose or energy that we can use when we are running from a bear. And I want to go back just a few slides. So just this one. So going down this pathway is not necessarily a bad thing. It's an evolutionary mechanism that we as humans have had, so that we can run from a threat, that we can recognize threat and run and save our lives. But what we as humans, I think, especially in this day and age, have a difficult time with is coming down from that high. We oftentimes stay up here, and we don't know how to use the tools to bring us back down into this parasympathetic mode. And so in this next slide, there's a lot of arrows, a lot of figures. I'm going to try my very best to explain this so that it is digestible, but please bear with me. So if you could follow my arrow here, we're going to start in the intestines. And so this figure is going to explain how the gut and the brain talk to each other and how stress can be effective or can affect our microbiome. Okay, so we'll start here in the bottom left. And so we're in our intestines. Oopsie, sorry guys, yikes, yikes. Okay, so we're in our intestines, and within our intestines, we have our microbiome. Microbiota and microbiome are essentially the same thing. And so remember that when our microbiome is off, so we're experiencing some dysbiosis, that the intestinal tract is leaky, as well as our blood-brain barrier. And there's other things that affect our gut lining, as well as our blood-brain barrier, but that can be saved for another talk. So today we'll just focus on the microbiome. But when that is off, we have a little bit of a leaky gut, and we have a leaky blood-brain barrier. And so these things, so microbial antigens, which are bugs essentially, and cytokines and prostaglandins, which are inflammatory markers, are able to escape the gut and go into the blood system, and they circulate until they get to the blood-brain barrier. And because this is leaky, they can then enter into our brain. And as you can imagine, if these inflammatory markers are coming into our brain, it can cause inflammation. And of course, that would affect our cognition. It might cause anxiety and depression. And it could affect our mood. And so another way that the gut can talk to the brain is through the vagus nerve. So the gut, or our intestines, is governed or innervated or controlled by our enteric nervous system. And what that means is that it acts separate from our spinal cord and our brain. And the way that it's connected to the brain is via the vagus nerve. And so anything that happens in the gut can then be transmitted to our brain via the vagus nerve. And then if you notice, all of these arrows are double arrows, so they can go both ways. So that if the gut gives some type of stress reaction to the brain, then the brain can also give a stress reaction to the gut. And so when this happens, this basically goes into what they call polyvagal theory, which essentially is that there's a stress that comes from the gut that goes to the brain, and the brain can react in many different ways via the vagus nerve. And the ones that I'm going to talk about really here are the sympathetic nervous system. So the brain can react because it's inflamed in a fight or flight stage, and it will increase your levels of cortisol, norepinephrine, and epinephrine, which, remember, norepinephrine is going to regulate our heart rate, so it's going to increase our heart rate, and it's going to allow us to have more glucose in the blood so that we can run from this bear. Another way that the brain can affect the gut is through chronic stress, which we've talked about multiple times. So if we're in a state of chronic stress, then it activates our HPA axis, which I like to think about as our stress axis. And so the brain will talk to the pituitary, and then the pituitary will talk to our adrenal, which our adrenals are also I also think of as our stress organ, will then release our cortisol, norepinephrine, and epinephrine. And so we have a lot of this right now, right? Because we have leaky gut, we're also in a state of chronic stress. And then another thing to add, which I learned when I was doing some research for this presentation, is that there is an area in the gut called the ileum that actually produces corticosterone, so cortisol. And they find that when the microbiome is off, that can affect how much cortisol is being produced. So then we have more cortisol, more norepinephrine, and more epinephrine being made. And that's just this picture that I've given you. There's like so many other diagrams and so many other influencing factors that play into this crosstalk. But then because of this, I don't want to focus on the bad. The good thing is that if we control our thoughts, and this goes into biofeedback and mind-body techniques, which is if we can control our thoughts, our heart rate, our breath, then essentially we can calm down all of our stress reactions that are going on. So this is why meditation works so well, and other stress relieving exercises or mind-body exercises. So now that I've explained the functions of some of the neurotransmitters and how those neurotransmitter levels can be affected, now I'm going to talk about the signs and symptoms of when your neurotransmitters are off. So that can be altered sleep, a decrease in concentration, fatigue, IBS or irritable bowel syndrome, an altered mental clarity, pain, sweating, dizziness, an increase in heart palpitations, attention deficits. And I do want to highlight this is because there is a lot of research on the connection between ADHD and the gut microbiome. And the research is pointing towards when we treat the gut, then it improves symptoms with children who do have ADHD. Other signs can be addiction, diminished energy, and motivation. So in conclusion, basically our human microbiome, so the bugs that are growing in our gut can affect our neurotransmitters in that when our gut microbiome is off, we're not making our neurotransmitters, and thus this is affecting our mood. So another thing that the gut can also affect is our hormones. So changes in levels of our neurotransmitters can affect our mood, but what about our hormones? So estrogen is one of the main sites in which it is processed is in the gut. And it's specifically processed by, beta-glucuronidase, which is an enzyme. And when those levels of beta-glucuronidase are elevated, it indicates dysbiosis. So again, an imbalance in our microbiome. And it also indicates problems with processing estrogen. So what does this mean? It means that when we have an imbalance in our gut microbiome, we have a higher probability of not being able to process our estrogens, which means that our estrogen levels are going to be high, which this is what us naturopaths call estrogen dominance. And all of us ladies know what this feels like, and maybe men too, but we know what this feels like every month because Miss Flo comes knocking on our door and says, "Hi, I'm here." And we might experience heavy periods, breast tenderness, irritability, anger, short temper, and many other things. I'm just thinking about the things that happened during my period, but I'm sure other women can probably add to that list. And so our gut and our gut microbiome is responsible for our hormone levels, which also can affect our mood. So that was a lot of talk about mechanisms and the gut-brain axis. And so now we're going to get into naturopathic approaches, and I'm going to give the mic to Dr. Paroo.
Thank you. So most of you are either current or previous patients of Holistique and have had experiences with us coming in and having a visit, and the amount of time that we spend going through your health history and asking you all sorts of questions. And I'm sure you're also familiar with some of the lab testing that we do in order to get more objective information. We do a fair amount of blood testing, which is a wonderful adjunct to the subjective or the story that you're telling us to determine where imbalances lie. But you might not be familiar with a couple other tests that we often do. One is a stool test, which is called GI map, and it can glean information about your large intestine. So it can tell us, what is the state of your microbiome? Is there bad bacteria there? Is there good bacteria there? How much of your good bacteria is there? Are there parasites? Are there viruses? Is there an overgrowth of yeast? So it can give a good picture of if dysbiosis exists in your microbiome. It can also tell you, it can also tell you
another person like us.
It can also tell you the state of how your digestive system is working. Are you absorbing your nutrients? Are you breaking down your nutrients? Are you absorbing your nutrients? Is there inflammation present? So it's a really comprehensive look at the functionality of what your digestive system is doing. The second test listed there is our Dutch hormone test, which is a urine test. And we included that because of the last slide where Dr. Murella was talking about the influence of hormones on your digestive tract, and thereby the influence of hormones on your mental health. This test looks at your estrogen, your progesterone, your testosterone, your adrenal gland function, and it can really give us a good overview of how your hormones are doing. It also has some indirect measurement of neurotransmitters. So again, there's that sort of crosstalk between, you know, how your hormones are affecting your brain health. So as naturopathic doctors, most of our approach is going to start in the gut, and it seems appropriate given the topic of our presentation. And that diet is first and foremost of where we start when we're trying to influence what's happening with your digestive function, be it trying to shift what's happening with the microbiome to reduce inflammation, and thereby that is going to have the effect of improving your mental health because of this crosstalk. So most of us, or a lot of people, don't realize how interconnected the body is. And we kind of feel like our mental, emotional health is sort of separate from our physical body, but that is the furthest thing from the truth. And the gut is so heavily innervated that it's called a second brain or a small brain. And I'm sure you've all had the experience of feeling butterflies in your abdomen, or you know, symptoms in your abdomen when you're under stress. And again, that's because of the crosstalk between, you know, this gut-brain axis. So oftentimes we try to encourage folks to avoid their food intolerances. You can consume fermented foods, fiber, prebiotics. All that is going to try to shift the bacteria in your gut and support the bacteria in your gut, with the intention of trying to reduce inflammation and improve the connection between your gut and your brain. Exercise and massage are on our slide because of the effect of them producing the neurotransmitter dopamine, which again is that feel-good hormone, or that feel-good neurotransmitter. And also exercise has been shown to increase the microbial diversity in the microbiome. Then we get into supplementation, and you know, as I said in our last talk, I think I said in our last talk, you can't out-supplement a poor diet. So that really should be the mainstay, but you can augment it with different supplements to sort of enhance and support what you're trying to do with your diet. And so I'm sure most of us are familiar with the concept of probiotics. Prebiotics are food for the bacteria. Glutamine is an amino acid that is food for our intestinal cells. Omega-3s and zinc and vitamin A and vitamin D. Basically, this list is talking about how do we calm inflammation down? How do we improve gut wall integrity because of wanting to improve our brain health, kind of indirectly, but directly, because again, everything is interrelated. You missed a slide, I think. Did you? Oh, yeah. So we have this slide again from our last talk, which is talking about some plant medicine and botanical medicine. And the herbs listed, again, the adaptogens have the effect of balance, where if something is understimulated, you can take the herb and it will support and stimulate. And if the system is overstimulated, the herb will have the effect of calming things down. And then our nervines, which mean to calm the nerve. And so this list is compiled of herbs that can support your nervous system. And when there's anxiety and depression, these herbs can be very helpful in sort of trying to balance your nervous system out. The bitters are the quality of an herb that is going to promote digestion. It's going to support your digestion. It's going to support the proper hydrochloric acid and enzymes to be secreted so that you can break down your food better, therefore providing better digestion, therefore providing better absorption, and then also affecting brain health.
And then, Dr. Paroo, if you don't mind, may I add just a few other things?
Go ahead.
Okay, and I want to add, just because I had been doing some research yesterday and I had learned of some really cool things that I'd love to share with you guys, and most of it has to do with treatment. So, oopsie, I'm having a really hard time with this, but going back to diet, another thing that's going to help with diversifying and supporting your microbiome is eating new foods, specifically vegetables. So eating 1 to 2 new foods a week. And the advice that was given was maybe trying, like going to an Asian store. I mean, I think that might be a little difficult now. But if you went to Awajimaya or the Asian Food Center, and the reason why I'm saying that is because there's always like really exotic vegetables or fruits that people have never tried. So for instance, like if you've never eaten a star fruit, maybe getting a star fruit from Awajimaya and eating that. And the reason why is because it has nutrients in it that help feed bacteria. And so if you introduce certain new foods and new vegetables, 1 to 2 servings a week, and starting slow because your stomach might not like it. Basically, it helps feed bacteria that might not be normally fed with your regular diet, and it helps diversify it and essentially help with improvement in your digestion. Another thing that I think I forgot to add was also being in nature, which might be a little difficult now too, but the parks have opened. But there is research that states that people who live in neighborhoods that are closer to nature, so like parks or trails, have more diverse microbiomes. And so they have a healthier microbiome. And so that would be also something you might want to try, is like spend some time in nature if you can. Another thing I learned, this is super exciting. I want to go back to this. And so so the reason why the gut, the microbiome, can talk to the vagus nerve and then cause a stress response is because it was evolutionary and advantageous for these bacteria. And the reason why is because they want you to have diarrhea, because they want you to slough off the commensal bacteria, so the bacteria that are normally in your gut, so that they have more room to grow. So these bugs are super smart, and I thought that was really, really interesting. I wanted to share that with you guys. And so now we'll go to the last slide, which is the part where we thank you again for taking the time to listen to us and learn from us. And we're super, super thankful for you guys for being here. So now we'll go ahead and open it up for questions. So if anyone has a question, feel free to go ahead and unmute yourself and ask it. Or if you feel more comfortable, you can also just send it. Any questions? All
I
right.
have a question.
Yeah.
You mentioned that it might be, well, evolutionarily advantageous for us to have diarrhea for the bacteria.
Not for us, for the bacteria. Sorry.
Yeah. So how did that create? So it's advantageous for them. It's not advantageous.
No, not for us. Sorry. So let me clear that up. It's actually Dr. Kieran, Dr. Marion, who had mentioned that.
Oh, cool.
I think I'm saying his name wrong, but he's an expert in the gut-brain axis, and he had mentioned that, like I said, the bugs in our gut will use the vagus nerve to cause a stress response, and in some people that might be diarrhea. And the reason why is because they want to create a home for themselves, and they want you to slough off all of your good bacteria so they don't have to eat as much. And so I thought that was super duper interesting.
Yeah, interesting. Thank you.
Yeah. Any other questions, guys?
I have a question. I'm not so sure if it's related to the digestive system, but I heard that taking a cold shower is good. Do you have any comments on that?
Cold shower is good for, do you have a specific thing that you thought it was helpful for?
For your nervous system,
For your nervous system? Well,
like lymph nodes and stuff like that. I'm not sure.
oh, you're talking about cold plunges, yes?
Yeah.
Okay, yes. So in some instances, cold is really good for pain. And so that can help the nervous system in that you're not feeling that pain as much. I can't remember off the top of my head the mechanism from our hydrotherapy class as to why we do cold therapy. Dr.
Want
Paroo?
me to hop in here? Is that okay?
Yeah, or I was going to ask Dr. Paroo if she wanted to answer.
Oh, I didn't see her swan, of course.
We don't have to fight over it. We can all
I think you were on mute, which is why I couldn't hear you.
yeah. Cold plunges. I think of that more as from a contrast perspective. So you're doing something that's going to warm you up, and then you're going to do something that's going to cool you down. So if you're doing that with a sauna or a cold plunge, it changes your. My understanding of it is that it increases your blood flow, and it redirects blood flow. So I don't know exactly how that would affect your digestive system per se. Dr. Marion, you have any thoughts?
What happens with alternating between hot and cold is that when you're applying heat, or when you're in a sauna, or when you're in a hot shower, the blood vessels are going to vasodilate, so they expand, and that increases blood flow to all of your tissues. And what happens when you then jump to cold, whether that's a cold plunge or a cold shower or cold whatever, is that your blood vessels then constrict. And so that helps with the pumping action of both the blood flow and the lymphatic flow, because the lymphatic system doesn't have its own pump. So anything that you can do to increase that pumping action, just as in like any sort of engineering process, we have to pump things back, is going to help improve that flow. And so alternating between hot and cold helps in that way. So you can think about what Dr. Murella was saying about chronic stress affecting the blood flow to the gut. It's often constricted to the gut. So alternating between hot and cold in the shower is going to sort of get circulation to places where maybe it's not getting because of chronic stress. And it's also going to help the lymphatic system remove some of the garbage and material that is stagnant if your lymphatic system isn't pumping efficiently.
And then actually now I remember what you were talking about with cold plunges. So cold plunges actually help reset your nervous system. Specifically, so I don't know if any of you have ever seen videos of people cold plunging, but the idea is that when you do go into a cold plunge, you then focus on your breath and you try to calm down and you try not to hyperventilate and you try not to freak out when you're in this state of stress. And so this goes back to what I was saying is that, you know, we are often at a high and we are often feeling the stress, but we don't know how to bring ourselves down. So if we can mimic and or put ourselves in a state of stress or sympathetic nervous system, fight or flight, and learn how to sit with it, breathe, and be comfortable in it, then that is a practice in how to go back to that stress down to the rest and digest. I hope that answered your question.
The other addition is, thanks for that, guys, docs, is that with the cold rinses, there is actually an immune stimulating response with that intense shift from hot to cold. So if you're taking a warm shower and then you finish off with the cold, there is, besides the circulatory and the nervous system response, there is stimulation of the immune system, the T cells, to fight off viruses and so forth. But the other thing that we do here that we don't talk too much about for whatever reason, it might be because it's such an old therapy, is something called constitutional hydrotherapy. And what that involves is using the hot and cold towels over the chest and the back, along with electromuscle stimulation. So we're basically giving you electrical stimulation at the same time that we're switching things from heat to cold and back and forth. And that does a number of things with not only the nervous system, the microbiome, the circulatory system, but also with the immune system, and kind of helps reset the whole body for a lot of chronic conditions, but also as a preventative measure. It's a very, very old therapy that's been used for decades, and it's kind of slowly gotten forgotten, but we still do it here, and it is one of the most transformative type of treatments, actually, that some people find. So constitutional hydrotherapy is the name of that treatment.
That's great. Thank you so much for the great feedback. I mean, I've been showering, cold shower. I didn't really know, what's the good reason, and this really turned the light bulbs, especially when you guys were saying about being able to calm yourself in a stressful situation. I think that helped a lot, because sometimes if I'm not mindful, I get hyperventilating. But when I'm really focused, then I'm able to breathe normally. So cool.
Yeah.
Thank you for that feedback.
Yeah.
There's a couple of other questions coming up. One is, are lectins bad for the gut, and how can you tell if we have leaky gut? And leaky gut, can it cause autoimmune disorder? So any of the doctors want to take that on?
I can take it. So lectins, yes, can be inflammatory to the gut. And the way that I learned from Dr. Darvish, how she likes to explain it, which is lectins are basically a protection mechanism for certain plants, because they don't want to be digested. They don't want you to eat them. And so they create a mechanism, and so that they can defend themselves. And so when you ingest them, they can cause some of an inflammatory response. One of the ways that you can get rid of the lectins or mitigate the response that you get from lectins is pudding, and some of those common foods can be potatoes and rice. You either soak your rice overnight, which some people might actually already do, and then another thing is cooking it in your Instant Pot, so your pressure cooker, because it helps break down those lectins so that it is easier to digest. And then back to your second question is, how can we tell if we have leaky gut? And one of the ways that we can tell is going back to our comprehensive laboratory test slides. One of the tests that we do is GI map stool test, and one of the markers that we usually add on to the stool test is zonulin, which is a protein marker that is elevated when we do see leaky gut. So if those markers are indeed high for a certain individual, then we know that that person has leaky gut. And then we do obviously all the approaches that we've talked about to address those and treat the root cause. Anybody want to add to that? Or should we go to the second question? Okay, so then the second question is it appropriate to take probiotics and prebiotics during pregnancy?
Just send them all and then they just.
Oh, I said 3.
That's what I just send them all.
Dennis,
See, I
do
just,
you mind if I ask you to put yourself on mute?
What's that?
Do you mind if I ask you if you could put yourself on mute just because we can hear your conversation?
Sorry.
No, it's okay. Thank you. Okay. So, is it appropriate to take probiotics and prebiotics during pregnancy? I don't see a reason why you shouldn't. And often
I
people.
wouldn't say that it's, oh, go ahead.
Oh, go ahead.
I was gonna say that it's not.
Go ahead.
Okay, you
Let
go.
me just finish what I'm saying. I would say that it could be somewhat helpful, and I don't see a reason why it's contraindicated unless the doctor disagrees with me, but I would assume that it could be helpful because during pregnancy, you get a shift in your hormones, which sometimes it can cause constipation for many different reasons, but your gut microbiome can be off with a shift of hormones. And so I don't see a reason why you wouldn't be able to take probiotics and prebiotics. But the thing is, and the key is finding a probiotic or prebiotic that is specific for you. And what I have found in my own practice is that sometimes people can take the wrong probiotics, and then I have them do a GI map. And first they had complained of like having diarrhea and gas and bloating, and then we do a GI map and they see that there was an overgrowth of certain bacteria that were in their probiotics. And it was like, okay, I think you should take a break from this certain probiotic and maybe we'll switch you or just take a break from it. And then her symptoms were alleviated because she wasn't taking a probiotic that was not specific towards this person. So go ahead, Dr. Paroo.
Yeah, I was gonna say the very same thing as far as I don't think that it's contraindicated and yeah, it just needs to be appropriate for the person.
Well,
Yeah.
There's a couple of products that we have here that provide food-based prebiotics, probiotics, and postbiotics. And it's basically the type of food that you're feeding your microbiome and allowing the microbiome to grow the signature of bacteria balance that it needs to grow for you specifically. So it's not necessarily giving you the bacteria that may be very limited in a capsule. There may be only like 3 or 4 or 5 types of different bacteria, whereas when you do give the food-based pre, pro, and postbiotic supplements, then it's actually feeding thousands of microbiome bacteria in your gut. So it tends to be much more effective than taking supplements. The other thing to keep in mind is that the probiotics that are sold over the counter, 9 out of 10 of them are contaminated and they don't have what they say in it. So you have to be very, very careful with the probiotic that you are taking because it can actually be contaminated with not so good bacteria. That's why it's one of those things that we naturopathic physicians are very sticky about making sure that you're getting the right one for you from the physician versus just online or some supplement store.
And the third question is, can leaky gut cause autoimmune disorders? And yeah, leaky gut can definitely be it can be part of the puzzle with autoimmune disorders. And in the GI map, actually, there is a section in which it tests for autoimmune triggers, so certain bacteria that tend to start an autoimmune disease. And so doing that test, we can see if there are any triggers, but then also wanting to remember that our gut is one of our important organs for detoxing. And I think that that's the biggest thing that we need in any condition, whether it's autoimmune, whether it's heavy metals, whether it's SIBO. or hormones, is having a healthy gut so that you're able to get rid of things that you don't want to hold on in your body. And so having healthy poops, this is why naturopaths always ask you about your poops, like, are you pooping every day? What shape is it? What does it look like? Is because we want to make sure that you're detoxing. Anybody else want to add to that?
I think that was fantastic, doctors. Thank you so much. I think we're running out of time. So I wanted to thank everyone for joining us again this afternoon, taking time out of your lunch to be with us. It's always a pleasure to see some of these familiar faces and meet new ones. And thank you so much, Dr. Paroo and Dr. Murella, for such a great presentation. Again, if you have any more questions and want to continue the discussion, please join Dr. Marian and myself tomorrow, either on Facebook Live at noon at the Holistique Medical Center, Facebook Live, Naturopathic Medical Center. I believe the address is Holistique Medicine. Or you can go on Instagram and join my or Dr. Marian's Instagram chat live at dr.darvish.nd or dr.marian.nd. And we will be happy to entertain any questions, and hopefully we won't be too entertaining, but we'll keep you, your minds and thoughts and souls activated. So thank you again, everyone, and we will see you again next week. We're doing this again next week at noon, and watch for your e-news, Holistique e-news, for the Zoom password and ID number. It should be coming either Monday or Tuesday morning. So hope to see you then again. Thank you again.
Thank you all so much.
Thank
Bye.
you.
Thank you.